The ongoing nurses' strike is impacting other local hospitals in a big way.
Our cameras captured this staff huddle at Kent Hospital. It's something they do daily, but today they're being forced to step it up due to an increase of patients. Eyewitness News consumer reporter Susan Campbell continues our coverage and has more now on how area hospital staff are coping. Susan?
Shannon and Steve, according to the Rhode Island Department of Health, all local hospitals have seen an increase in patients in the past 2 days. Around 4 o'clock this afternoon, we learned the Merriam Hospital went on diversion, meaning ambulances are being directed to take patients to other hospitals. This is following a 20% increase in patient volume at Merriam since the strike.
The ambulance bay filled up as a steady stream of first responders dropped off patients at Merriam Hospital.
He said it was chaos.
Diane Pellegrino's husband is in stage 4 renal failure. He usually goes to Rhode Island Hospital, but was diverted to Merriam because of the strike.
It was a little nerving. That's serious stuff.
Mike Fisk was also brought to Merriam to be treated for injuries he suffered in a car accident.
There's a lot of people in there, but Merriam is handling it so well that it doesn't seem anywhere near as bad as it could.
We have 7 patients.
Kent Hospital is also seeing an increase in patients. There's usually one of these safety huddles each day. Now there are 2.
We added the additional one to make sure all the latest information was being shared, given the issue with the strike.
Jim Beardsworth is a spokesperson for Care New England. He says on a typical July day, Kent Hospital would have about 160 to 170 inpatients. On Monday, the hospital had 210 inpatients.
We've been looking at this now for a couple weeks, so the staffing obviously is something we need to make sure it's appropriate with the volume. In places where necessary, we're making sure additional staff is there to support that need.
Since the strike, Beardsworth says Butler Hospital's overall activity is up about 10%.
And since the strike began, we've been tracking the impact at other area hospitals.
As we reported live at 5, Merriam Hospital's ER went on diversion late this afternoon. Other hospitals are dealing with an increase in patients. Eyewitness News reporter Susan Campbell continues our in-depth coverage. Susan?
Mike and Shannon, a spokesperson for Care New England Hospitals, tells me this is a fluid situation. He says staffing is up to handle the extra patients, and so far patient volume has been manageable.
This is unbelievable how you're all stepping up.
At Kent Hospital, we were there for this afternoon's staff safety huddle. Usually there's one of these meetings a day. Because of the strike at Rhode Island and Hasbro Children's Hospitals, there are 2.
When something happens at one place, especially with healthcare and with the hospitals, there is a ripple effect.
According to the Rhode Island Department of Health, across the state, hospitals have all seen an increase in patients since the strike started.
Across Care New England, Butler, Women and Infants, and Kent Hospital, we're definitely seeing busier than usual, but still very manageable.
Lifespan's Merriam Hospital is reporting a 20% increase in patients. Late Tuesday afternoon, the influx forced that hospital to divert ambulances to other facilities. Mike Fisk was just discharged from Merriam following a car accident Monday.
An awful lot of people in the hallways, and they were handling it. And my nurse was on for 16 hours. You know, that's a really long shift. I mean, I've done some 12 hours, and these people are taking care of people's lives.
We have some numbers for you to take a look at. On a typical July day at Kent Hospital, there would be about 160 inpatients. Yesterday, there were 210 inpatients. Women and infants also saw a 15% increase in inpatient volume, and Butler Hospital's overall volume was up about 10% yesterday. The Department of Health says Landmark, Roger Williams, and Hasbro have all gone on brief diversions since the start of the strike. I'm Susan Campbell, Eyewitness News.